Welcome to our YouTube channel, or welcome back if you have joined us before. My name is Maria and I am the owner and founder of the New Mummy Company here in Oakville, Ontario. And today I'm delighted to welcome back to our YouTube channel, Caitlin, who is one of our LCs. And today we are going to be talking to you about all things tongue tie. Caitlin, thank you so much for joining us.
Thank you for having me.
We are excited to have this chat. This is something I've been wanting to chat to you about for quite some time because it's something that seems to be coming up more and more often. Do you think the tongue tie is more prevalent, or is that just that we're now more aware of it? What do you think is going on with tongue tie?
I mean, there's theories as to like how a tongue tie is formed and what may be causing more tongue ties in babies. I think a lot of it too is awareness that we didn't have before. You know, like if a mother was experiencing some of the symptoms or baby was experiencing some of the symptoms, it could easily be misdiagnosed for something else or something that just kind of had to be pushed through. And now we just have a lot more awareness and a lot of practitioners that, you know, have good information out there for parents to look at. So yeah, I can't say for sure if it's like, if you know, these theories that exist out there are true and that there's more, or that it's also a combination of us just knowing more too.
Wonderful. So if we were to try and define tongue tie so that parents could understand what it means, I'm sure a lot of people have talked about it, but what does it actually mean? What is a tongue tie?
Okay, so it's what it like the basically comes down to is that there's a restriction of the movement of the tongue. Okay, so, you know, if this is your tip of your tongue and this is, you know, the floor, the roof of the mouth where the tongue sort of connects with the bottom of your mouth, it means that somewhere along here, there's almost a tether, a little string-like or rope-like piece of skin, I guess, tissue that connects the tongue down to the floor of the mouth. And then that sort of restricts the full movement of the tongue. So when we talk about tongue ties, there's various degrees of tongue ties, different types of tongue ties, but and then whether or not that type of tongue tie has certain effects or symptoms that comes with it is a whole other story, but it's basically restriction of the movement of the tongue.
Okay. And so that has implications then for feeding because it's impacting the movement of the tongue.
Absolutely. Yeah. So, okay. So I want you to picture like a kitten lapping up milk from a dish, right? They extend their tongue and they move their tongue in sort of like a wave-like motion to get that milk and to bring it back into their mouth, right? So imagine that kitten now couldn't extend their tongue, right? They really couldn't extend it past their jaw line and couldn't get that tongue out. It would become very difficult for that kitten to lap up milk from their dish. So similarly, a baby massages the mother's breast or even bottle to get the milk to come out. So if they're unable to massage it properly, they can end up sort of just using their jaw to compress on the bottle or compress on the breast tissue to get that milk to come out. So then, you know, that has many feeding implications, right? Like a baby that's not gaining well, or a mother that has pain, and there's lots of different implications because of that.
So if you're a new parent, would you expect to see the implications of a tongue tie right away? And like, is it something that the baby is born with? Is it something that develops later? When would a parent become aware of it?
Right. So it develops in utero. So babies are born with a tongue tie, or born without a tongue tie, or born with a more severe tongue tie, or born with a mild tongue tie. So, and then sometimes it's not noticeable right away, or the symptoms aren't there right away. Some babies use, like, they compensate with different muscles in their jaw. And maybe mom has this like amazing, you know, free flowing breast flow, or baby can feed really beautifully out in the bottle. And then a couple months later, you start to see other symptoms crop up that are unrelated to, you know, those initial first 2 months. And then in other cases, we see it almost right away, where baby can't latch on, or mother's breasts are in excruciating pain, or baby is not thriving and not gaining well on the bottle, or that they're very gassy and uncomfortable, and having symptoms related to, reflux type symptoms, right? So we can see it at different stages with their development. Even sometimes it's not even caught until later on, until a baby starts to, use words and speech starts to develop. And then, when the child enters school and they're school aged, teachers report that they're having difficulty with speech, and suddenly that's an issue. Or even when a child starts solids, they start to have issues actually eating solids and moving away from the mushy foods, and having solids with some texture in it.
So what are the typical signs and symptoms that that a new parent would experience that might lead them to think that this was possibly one of the reasons behind some of the feeding issues that you mentioned?
Mm-hmm. So, I mean, I guess initially, like if we're talking about like the first few weeks, and let's focus on breastfeeding first, like one major sign is either baby is unable to latch, or mom has like when they describe those cracked, creased, bleeding nipples, they sort of like their nipples are getting very flattened, and they have like a line almost across their nipple after every time the baby comes off of the breast. So oftentimes that can be a sign. It could also be a sign that baby just has a tight jaw and needs to relax and stuff like that. So it's not always a sign that there's a tongue tie, but it's definitely something that you want to get assessed if you are seeing those cracked and creased nipples. Also, like a baby that's not, gaining well in those first couple of weeks, despite, everything appears well at the breast or even at the bottle, right? So baby just isn't gaining well with the bottle feeding because they're not able to consume enough, or they're tiring while they're bottle feeding. So those are a couple of symptoms to look for. Also really noisy feeding. So bottle or breast, like if you're hearing a lot of clicking noises, so like, I don't know if you can hear that on your end, but it's a slipping of the tongue. So the tongue's not able to handle the milk flow, and it slips and it makes sort of a snapping noise as the baby's feeding. So those are kind of like some major signs, I guess, initially on whether or not baby has a tongue tie.
And then of course, mom's going to experience pain if her nipple was flattened.
Yes. Yeah. Usually like mom will say like, that it feels like cinder blocks are compressing, and that's because the baby's compensating by using their jaw to breastfeed, and compressing down on that nipple. Yeah, for sure.
Okay.
Like anytime those symptoms exist, again, it doesn't mean baby has a tongue tie, but I would say like, if you're hearing some of those symptoms and you're saying, oh, this is similar to my case, or I remember that when my baby was, an infant and a newborn, then maybe it's worth just having somebody assess it and see, is there a tongue tie that is present?
So you're mentioning getting assessed. What is the first person, like what's your first port of call? Is it an LC like yourself? Is it a doctor? Is it a pediatrician? Who would be your first port of call if you suspect that your baby has or had a tongue tie?
I mean, I would say a lactation consultant. And that's not necessarily because I'm a lactation consultant that I'm saying that like, oh, bring me business. I just think like, because we're so focused on infant feeding, that we're very aware of like how, the oral cavity is supposed to work in relation to feeding, right? And some pediatricians have a background and that's really, specific to that as well. And they've taken an interest in that. But pediatricians and GPs, like they have a really great like knowledge base across so many different areas related to babies. So I personally feel like an LC would be your first stop. And then, if you wanted to like confirm further, like there's pediatricians that do specialize in feeding related issues and releasing tongue ties and assessing tongue ties. There's also pediatric dentists that again, specialize in that, but it depends on if that pediatrician or dentist specialize in that area, right? I would say if you're going to get assessed by a pediatrician or a dentist, make sure it's somebody that specializes in that area. Mm-hmm.
And so what are the treatment options? So as an LC, are you the one who is treating the tongue tie, or do you have to then make a referral on, and what are the treatment options?
Right. So as an LC, I wouldn't be treating a tongue tie. There's like different, positionings that we can do to help make breastfeeding more easy for mom and baby. And then there's different little exercises that we can help guide you in, but we would definitely be referring on to again, a pediatric dentist or a pediatrician that specializes in infant feeding and releasing tongue ties. Because our job is to say, yeah, we feel like there is something here that's restricting baby's movement. And now here's where you go to have it, formally diagnosed and then formally taken care of. Right. So once you go to that pediatric dentist or that pediatrician, that they will assess again whether or not that tongue needs to be released. And by release, like, how I said, there is that tissue underneath the tongue, right? So let's say it's right to the tip, and we can see that baby has very limited range of motion with their tongue. Then the pediatric dentist or the pediatrician will release it there. And there's different techniques. So there's like a scissor technique or a laser technique, and they release it on the spot. Like there's no, baby doesn't go under general anesthetic. It's just released right away. And then you're encouraged to feed baby right away. Again, with the bottle or the breast, you're encouraged to feed baby right after that happens. And it's literally seconds long. It's not like, this hour-long procedure. It's seconds long.
So hopefully that will make parents feel a little better that the ordeal that they may have envisaged is, yes, of course, we're not taking away from the fact that it is a procedure, but that it is in fact a very quick procedure, and baby is encouraged to feed right away.
And again, it's just excess tissue. So there's no cutting through muscles or tendons or anything like that. It's just excess tissue that grew there, really. And it can have a genetic component. So sometimes, like hearing whether or not your husband had it, or like your uncle had it, or your husband's whatever brother had it, like there's different, you have to look at that genetic component as well. And so then also asking how was, you can ask like a mother-in-law or your mother or whatever, like, how was it feeding that baby? Right. And there's different signs that may, point you in that direction, that maybe your spouse or you had a tongue tie too.
So it can be hereditary, is what you're saying, to be aware of if you suspect that you have the tongue tie. Okay, that's very interesting. So is it true that tongue ties can occasionally come back, that they can reattach, and that they can potentially need to be released for a second time?
It's very rare, but it has happened. I mean, it does happen. Okay. So there's the tissue can not necessarily regrow and reattach, but kind of thicken. Right. And then sometimes it needs to be redone, but I would say that's quite rare. It's not often that a baby's tongue would need to be re-released.
So when you are supporting a family at the point of diagnosis of a tongue tie, are you involved after the release of the tongue tie? Do you need to continue to support them, or is it a short term? How involved would you be after a tongue tie has been released? Right.
So oftentimes, I'll see a family one more time after a baby's tongue tie has been released. And if they don't see me back, then we'll have some communication via text and stuff like that, because it's often not suddenly, right after the tongue gets released, baby is an amazing feeder and things are glorious and perfect, because you have to keep in mind that baby had that tongue in utero, and babies practice those skills in utero. And then baby came out into the world and learned how to feed a certain way. So let's say your baby got their tongue released at 3 weeks. Well, they practiced in utero. And then for 3 weeks, they've been practicing, with a tongue that didn't have good movement. And now they've got this floppy tongue in their mouth that has excellent movement, but they almost have to like relearn how to use this new tongue because they've always been using all like it in a different way and using these accessory muscles to compensate while they eat. So I like to tell parents you're not necessarily going to notice that difference like right then and there. I mean, some parents do. I've had some moms say, oh my gosh, like for the first time it's pain-free. But I like to tell parents like it takes a couple of weeks for babies to relearn that skill and change that habit, I guess. I don't want to call it a habit, but yeah, change the way they have been doing something.
Well, I mean, it probably is a habit. Like when, like you say, they've learned how to suck in utero, and then they come out, and because this ultimately does take some time for the parents to see that like this is hurting or this is uncomfortable or that baby's not maybe gaining as much weight as they would have hoped, that it can take a little bit of time to get to the point of being diagnosed. So yeah, baby's doing a lot of learning in those early weeks, so they just need to relearn. So I guess that's helpful to know that your support can support that baby and support the breastfeeding parent to be able to have that ongoing support as
Right.
it's needed.
Right.
In terms of bottle feeding, if you are expressing your milk or if you're feeding your baby formula, is there similar clicks that you would hear when the baby feeds? Obviously, the bottle's not going to hurt, so we know that there can be no pain there. But what sort of symptoms are they fairly similar when it comes to bottle feeding?
Right. Well, I mean, when we talk about the nipple being compressed at the breast, right? Similarly, a baby that's bottle feeding, we'll see them come off of the bottle and the bottle nipple has been completely compressed and flattened, right?
Okay.
So we can still look for that symptom. It's going to be on the bottle teat instead. And then, yeah, there's going to be there's oftentimes lots of clicking or choking or gagging. Again, that's breast or bottle, those noises and stuff that can be had. Very gassy, uncomfortable, inconsolable baby. Like when you look up symptoms of reflux, like similar symptoms will be listed under like a tongue tie that would be listed under reflux. So we want to always make sure that this baby doesn't have a tongue tie before we diagnose with reflux. And or a baby that's, not consuming what they should typically for their age, right? So, a baby that really has a hard time consuming what they need. Maybe they take, 30 mLs, right, of a bottle, and then they have a large spit up, right? And then they're crying and they're unhappy. And then an hour later, they want to do it again. And then they're not really gaining well, right? Despite having as much milk as they want to take, right?
Yeah.
Mm-hmm.
Yeah.
Yeah, so those are definitely signs.
So if a parent suspects that they have a tongue tie, let's just recap for them. What would be the steps that they should take?
Right. I mean, I would say if you strongly feel that, then you should definitely meet with a lactation consultant, pediatric dentist, or a pediatrician that specializes in the tongue ties. And then, keep in mind that some of the symptoms that I've said, I mean, they could be related to a tongue tie. They also could not be, right? But I guess it's best to just cross your T's, dot your I's, know that your baby, doesn't have this and that you can address the issue in a different way, right? And that also not all tongue ties need to be released. So, you might go to the pediatric dentist and they say, oh, your baby has, different pediatric dentists use different terms, but they might say, a type such and such tongue tie, or this baby scored this much on, this tongue tie assessment chart, right? And they might say it doesn't need to be released because your baby has good functionality despite, a tongue tie being back here, right? So that's why it's also important to get it, formally diagnosed and have somebody say yes, it definitely is impacting things or could impact things in the future.
Wonderful. Wonderful. Well, thank you so much, Caitlin. This has been a tremendous amount of information. If you do suspect that you have a tongue tie, just know that the help is out there to be able to get your baby gaining weight, to be able to reassure you as a parent that this is not your fault, you haven't done anything wrong, and that there's nothing you did in your pregnancy that could have caused this. Isn't that right, Caitlin?
Right.
Yes, it could be
Right.
hereditary, but it's not something
Right.
that the mom did while during pregnancy.
Right. And then I think another important note is that it's not just something that's going to impact that baby because they're breastfeeding. Okay, so I can switch to bottles and things will be better. It's not necessarily going to be better just because you switch to bottles, or I'll just deal with this, but once they're a year old, this will be better, right? Because then there can be other implications, like I said, about the solid foods or speech or snoring, or there's a whole whack of things. But yeah, so to know that it's definitely important to get it checked out because there is those longer lasting implications.
So it's not just the newborn stage, it's
Right.
the solid stage, the starting school, the speech,
Right.
all
Right.
of those. Okay.
Right.
So
Right.
from that perspective, it is worth investigating.
Yeah.
And I guess going with your parenting instinct on you knowing your baby best and knowing that if you do need help, that you reach out to ask for help. Caitlin does offer virtual Zoom appointments, and those are available to you regardless of where you are in the country or in fact in the world. We are happy to be able to support you no matter where you are. So Caitlin, I really appreciate you giving us your time to chat with us today. If you have found today's video helpful, then please do come along and give us a thumbs up at the bottom of the screen. If your baby had tongue tie and it was diagnosed, we would love to hear your comments as to what did you experience? How did you eventually come to the conclusion and get that diagnosis of it being a tongue tie? And did you have the tongue tie released? We are back every Thursday with a new YouTube video. If you would like to sign up and receive those notifications, then do hit that subscribe button and also hit the bell so that you don't miss out on any of our videos as they're released. So for us, it's goodbye for now. Until the next time, thank you for watching, and we'll see you again very soon. Bye.